We stay with this crisis in Hammanskraal and cholera. The deaths of these other two people has now taken the death toll to 17. More than 60 people, to remind you, have been admitted to hospital. Very, very concerning. Let's welcome to the show Linda Erasmus from the NICD. It's the National Institute for Communicable Diseases, making time for me this afternoon. Linda, good afternoon to you, and thank you very much indeed. As an organisation who deals with communicable diseases, when you hear the Tshwane mayor saying they don't know what the source is of cholera in this part of the country, how concerning is that?
Good afternoon, and thanks for having me. There are very active investigations going on at the moment to investigate the source, and maybe just to emphasize that that is quite complicated. So every cholera case that there is, you would interview and try and get an idea of, have they been traveling, what are possible risks, what is their water supply, has someone in the household been ill? And then obviously where you have an outbreak like this, you need to look, where are the patients coming from, what are the water sources and all of that. And then maybe just to emphasize that there's a lot of environmental assessments. So obviously sometimes water supplies are complicated. They may come from a water plant or a borehole, then go to tankers, then go to households where they get stored. And you need to try and look at possible contamination points at any of those places along the supply chain.
Is there something that we could have looked back at maybe a week or two ago? I understand this has been around in the area of Hammanskraal for many, many years now. But now with this outbreak, would there have been indicators that experts on the scene, if experts had been watching this, Linda, could have picked up on as early indicators of an outbreak?
So we do have surveillance in place for cholera cases. And certainly we had a huge outbreak in 2008, 2009. And since then, we've had very few cases during the year, and certainly nothing to indicate any outbreaks in that time until the beginning of February this year. So there are systems in place, and anything that is notified, is followed up, is looked at to check whether the public health action is necessary. Obviously, part of that is you need healthcare awareness so that people test for cholera. And then I guess the other aspect of that is municipal water testing, where they look for indications of how clean that water is.
How difficult is this, Linda? I'm trying to get into the homes of people who live in Hammanskraal. If, for example, one person has picked up, in this case, the early indicator seems to be diarrhea in a case like this. How does the rest of the family protect themselves so as not to spread it? I mean, I imagine it's a case of not drink the same water, but is there anything that a family can do to protect the other individuals from someone who might have it?
So there are general precautions that you can take, and we do sometimes see household members developing the disease after someone else in the house has had them because of close contact. So cholera basically spreads through ingestion of contaminated water, either water itself or where that water's been used to wash food or in food preparation. And then you can also get person-to-person transmission, where maybe someone in a household has been to the toilet, hasn't washed their hands completely, and has prepared food or something. So the general principles are hand washing, which of course is challenging in a time where you have limited water supply, or if your water supply is perceived to be unsafe. As you said, Department of Health have also mentioned using alcohol sanitizers as an alternative, but soap and water is the ideal. And then it's things like safe food practices, storing your food properly, cooking it properly, not leaving it out after it's been prepared. Washing hands after toilet, after changing a nappy, before preparing food. Things like using, as far as possible, safe water supplies. And if you have any doubts about your water supply, to use something like boiling, which again is challenging given load shedding, but you can also use household bleach in order to make that water safe. And there is information available on what kind of measurements you would use for that. And also just, avoiding swimming or recreational activities in water that may be unsafe. So rivers after floods, anything that looks like it might have been contaminated with sewage, etc.
Can we talk just for a moment? Help me understand. So we have locally acquired indigenous cases, and then we have imported cases. Linda, I'm taking a look at the NICD website, nicd.ac.za. For anyone who wants to go take a look, they have a wonderful explanation on this outbreak at the moment. So locally acquired cases, but then we also have other countries like Malawi, Mozambique, Zambia, and Zimbabwe. Do we know if they're in any way linked to what's happening here in Hammanskraal?
So, in fact, we first identified cholera cases in South Africa in February this year, but those first few cases in February and March were from city of Johannesburg and then also Ekurhuleni. And in fact, the very first two cases were linked to travel to Malawi, where we know that we have an outbreak. And the third case was a close household contact of one of those cases. Where we say they're indigenously required, we're saying that there's no history of international travel. So we're assuming that it is coming from a local source. But there's nothing to indicate. We've currently got outbreaks in Free State, in the Vredefort, Parys area, and then in Hammanskraal. And then, as I say, the initial cases were City of Joburg Metro and Ekurhuleni. And we don't have any strong epidemiological evidence to suggest that those are all linked.
At what point do other parts, Linda, around the country, now obviously I don't want to mean to cause any alarm whatsoever, but at what point do we start bringing in the National Health Department, the national governance on something like this? What sort of data do you have to show that perhaps this is not going to be spreading to other major water points which could spread outside of Hammanskraal? How worried as a country should we be?
So really the risk is it's the communities that are vulnerable worldwide, not just in South Africa, to getting a cholera outbreak are the ones that have unsafe water or inadequate sanitation. So there's always a risk here that someone who's infected in one of the current outbreaks may travel to another province and then infect somebody else, and then local infection may be established in a vulnerable community. So that is always a risk. Just in terms of national involvement, from the second you see an increase in cholera cases, even though a lot of the local action is taking place on a provincial or district level, national are involved and having daily meetings and monitoring, and many preparedness plans being put into place on a national level.
I see as well many other countries apart from the SADC region, Linda, that I mentioned a few minutes ago as well. At least 24 countries globally are experiencing this. Is this a seasonal issue that just seems to be much worse this time round? Are there environmental factors at play? Or is this something out of the blue that's even caught the NICD off guard?
So we don't have endemic cholera, which is we don't have regular transmission of cholera in the intervening years, but many other countries do, where they have cases all the time, and then they will have an unexpected increase in cases that will comprise an outbreak. It may be related to flooding and climatic conditions. It may be related to things like civil wars and people migrating and having concentrations of people with unsafe sanitation and unsafe water. So there are many factors, but as I mentioned, unsafe water, unsafe sanitation, or not improved sanitation make a community vulnerable.
Linda, just very briefly, as I say goodbye to you, this is being called an outbreak at the moment. Why does it fit into the bracket of an outbreak? This is not to downplay at all the 17 deaths and the over 100 people who've contracted cholera. What makes this an outbreak in your understanding, according to the NICD?
So any disease has a threshold for outbreak. And for cholera, if you see a single case of cholera, where you in an area where you previously have not been seeing it, it constitutes an outbreak.
Linda, thank you very much indeed for your time this afternoon, making a lot of sense as to how this is being managed, how it's being looked at, and from an epidemiological perspective as well, how it's being investigated. My thanks to Linda Erasmus from the NICD, of course, the National Institute of Communicable Diseases, taking us up to 3:15 this afternoon.